Hi, I'm Kim Stevens here in the Fox 26 newsroom. Hey, I don't know if you've taken a look at the forecast or not, but the triple digits are gone. We're now in the 90s, really nice. We're moving into the 80s, and then the triple digits will be back. And then, of course, we know that the weather will start getting cooler. So there's a lot to just get used to or try to when it comes to the temperature outside and inside. And what reacts to that? Our skin. We're either really sweaty in all of that heat, or all of a sudden we're getting really dry. And what is a person to do? So it is time to find out how we can better care for our skin and not have so many itches or any other problems. Dr. Rohini Shantharan is here now to help us out. Thank you so much for being with us today.
Thank you for having me, Kim.
So, I was just saying how our weather is changing, but I mean, it can change anywhere. We usually notice around the fall that, wow, our skin starts to really get dry really fast. Is this normal for our skin to have changes throughout the year?
Absolutely. As we move through the different seasons, the seasonal changes typically is what brings on a lot of the changes within the skin because it's the quick change in climate, like you mentioned, from a more moist or humid, hotter environment where we're sweating more to a drier climate as we approach fall and winter. So, the most important thing to do is to just be really good about moisturizing. We tend to recommend putting your moisturizer on within 3 to 5 minutes of bathing. The goal is to use moisturizers that are rich in ceramides and hyaluronic acid so that it can retain the moisture in the water to keep that skin barrier intact. And so we recommend, avoid long hot showers. It will dry out the skin and make your skin itchier. And then the more you scratch, the more the skin will kind of break down and dry out. So we tend to really talk about that as we approach fall and spring, not just with our adult, older patients, but also with our pediatric population.
Is there an ingredient that we should look out for to say, if we see that on the ingredient list, we are not going to use that because that would not be helpful?
So, and there's lots of different ingredients that help to create moisturizers and help to keep them on the shelf. We try to use preservative-free moisturizers. There's different brands that we recommend overall to keep it simple because you can spend your whole day looking at the back of a bottle at the drugstore to figure out what to use rather than going down that route, unless it's the specific patient has a true allergy or sensitivity to it. We'll just give a recommendation of what's appropriate to use for pediatric patients, babies, and then adults. The overall theme is to avoid scented products. So the bath and body that most people love, that smells good, isn't always the best for the skin. It will cause your skin to become more irritated. And then those who already have more eczema prone skin, it will just trigger a flare up. So we try to avoid those kinds of products.
Okay, all right, that's helpful. You said two ingredients that I've also heard in facial products for anti wrinkles. And I know that there is a certain point where maybe there's only so much we can do, but aging happens. But if we'd like to try to kind of keep the wrinkles at bay or do whatever we can, what do you recommend?
Of course, preventative measures. So we always start with making sure you're wearing your sunscreen. So you mentioned it. Wrinkles are a sign of aging and sun damage through the years within the skin. We have many ways of treating them as a cosmetic dermatologist. This is sort of what my bread and butter I'm doing all day, every day, with more aggressive therapies. But we like to start with recommending good skincare. So, ceramides and hyaluronic acid are ingredients within a lot of these products that help to retain moisture. They're hydrophilic, so it helps to keep water in. As we age, our skin's ability to keep water in compared to when we were babies isn't as great. And so then the skin will look dry and dull, and the appearance of those wrinkles will look more prominent. So we tend to have, moisturizers that are over the counter like CeraVe, Cetaphil, Neutrogena, La Roche-Posay are great. We do have medical grade moisturizers and skincare. One of them I recommend, Alastin, the brand. There's so many different ones out there, but they have maybe a few more ingredients that may help calm down some redness, help, calm down the blemishes, lots of different things that are out there. But that's sort of how we start. And then, of course, using retinol or retin-A is one of the big key anti-aging ingredients as well.
Is anything less than 2% effective?
For as far as retinol or retin-A?
Yeah.
Yes. So retinol is the derivative of retin-A. Retin-A came onto the market, and it's a prescription to treat acne. And we found that it actually helps to treat acne scarring by stimulating collagen remodeling. And so we brought onto the market a derivative that's a little bit less intense, a little bit less irritating, as an anti-aging product called retinol. It is going to help, and it's going to be beneficial for, anti-aging purposes. The milder percentages are not always going to be as efficacious for treating things like acne, but yes, there is benefit to using it. The over-the-counter ones are a great place to start. You want to make sure that it's not drying out your skin too much, and so you kind of build on it, and then we can work up to being on higher strengths, but there is benefit to doing the lower strengths.
I've been noticing, I don't understand all these ads, how they just keep coming into my Instagram feed, but I see so many of them now on, is your skin crepey? And I thought, what is crepey skin? And I went, oh, it's like crepe paper, and it has an interesting, I don't know if we say wrinkle, but just texture to it, where it just consistently looks maybe dry or just not as, I don't know, bounce backable. I know that there's a better word for that. And there's one brand, I guess, that I'm seeing online that's being promoted by some actresses and such. But what do you say to someone who says, oh yeah, I've got that crepey skin. Is there anything I can do to make that go away?
So the short answer is crepey skin, hard to treat, and there's no cream that's going to make it go away. When, patients come in and they kind of, pull the skin up and say, what cream can I put on for this? Crepey skin is a little more complex. You mentioned a couple things, that ability for the skin to bounce back. So it's part of the aging process. As we age, we lose collagen, which is the building block protein of the dermis, which is the deeper component of the skin, that as you age breaks down, and it loses its integrity and its thickness and its strength. And then the elasticity. So our skin also has elastin bundles which break down. And so the recoil of the skin, its ability to bounce back, starts to decrease as we age. So there's certain areas that we'll see crepiness become a little bit more predominant. We see it, of course, on the arms and the hands because we're getting a lot of sun exposure, and most people don't realize that they're getting that through time. But we oftentimes, for most of my patients who are coming in for cosmetic treatments, which is usually what we're doing to treat some of these things, is the neck area and the chin area. Because of gravity and the way the lymphatic flow is, we'll start to see some of the changes there under the chin.
Okay. And can you just massage your chin and your neck every morning for, like Marsha, has she brushed her hair 100 times a night or something? Can we just do this a lot and we'll be fine?
Unfortunately, I wish it was that easy. But it won't fully treat it. So starting, in your 30s with like a neck cream that has some of the ingredients that boost collagen, some mild retin-A in it, can help to decrease some of those from happening so quickly. We call that prejuvenation. So we want to kind of get ahead of the game. But we're doing we need to do treatments that stimulate collagen and elastin. So I use laser and light therapy, combination of biostimulatory fillers in combination to treat that area, which is a difficult area to treat. But there are lots of options now.
We are in the month of August, and August is known as National Psoriasis Awareness Month. Can you explain? We see a lot of ads on TV and how that really can not only be painful, but also can keep people from even feeling like they can go out because they're embarrassed about what's happening to their skin. Can you explain more about psoriasis and how to treat it, make people feel better?
Yes, psoriasis is a skin condition where the body sends out sort of an immune response to rev up the cell turnover of the skin cells that will typically occur over weeks, but in particular areas of the body where psoriasis is flaring, it will happen over days. And this then causes the skin cells to kind of build up and form a salmon to pink colored plaque with some white to silvery scale, which will typically take place on the knees or the elbows, the lower back, frequently on the scalp, sometimes involving the nails. And so it can be difficult because it's not only itchy, but of course, the social impact of it. So we take this condition very seriously. It can also come along with mental health issues such as depression and other comorbidities that we're watching out for. And there are a lot of ads on TV and a lot more awareness for psoriasis now because fortunately, we have a lot of more targeted therapies, immunotherapies to treat the psoriasis, which, 15, 20 years ago, we had only a few medications. We started with topical therapy, and then we used immunosuppressants that would really suppress your whole immune system. Fortunately, now they have been able to isolate the immune pathway that's truly involved in psoriasis, and we can just specifically target those interleukins that are involved, which sounds really fancy, but there's so much science that's gone into it. But these medications are very effective and safe to start even at younger ages. And so that's why we see a lot of commercials about it now as well.
Wow, that sounds wonderful and freeing.
Yes. We see psoriasis so frequently, not only in the form of skin, but we will also see it in the form of the joints. So psoriatic arthritis, which is arthritis in the joints of this. Sometimes it starts in the hand, sometimes the heel. And we like to be aggressive about treating those, and we'll oftentimes work with a rheumatologist to diagnose it because the inflammation that causes joint damage tends to be irreversible. So we need to get ahead of the game and prevent the damage from occurring and affecting individuals later on.
So people really do need to speak up if they start noticing that they're having these feelings or their body is changing, and speak up and not disregard it or just try to be tough and move past it, because earlier you attend to it, maybe the better.
Yes, exactly. You hit the nail there. We typically want to see patients early, even pediatric childhood patients, because obviously there are social implications in not treating it. Patients who haven't worn shorts for years or exposed their arms, and we can clear it up essentially in about 3 to 4 months, given the chance. And then, of course, making sure, and we will typically ask about joint pain and try to identify what's going on. And many times patients won't realize truly that they've had some form of the joint pain. And so we'll monitor how they're doing on medications, seeing how it affects their quality of life, which is, really important in treating this condition, because even a small plaque in the scalp can affect someone's social confidence so significantly that we take this condition very seriously.
What about eczema and dermatitis? I remember back in my 30s, early 30s, I'm on TV and wear all this TV makeup, but I started to have really bad scaly and itchy, and oh, it hurt so bad, and nothing seemed to work. Now I know, wow, me, it went away. But I mean, there are a lot of people who have these things, whether it's on their face or on their body, and it's also uncomfortable and can kind of keep you from wanting to go out.
Yes. So, dermatitis is a pretty, it's like an umbrella term for inflammation of the scalp. or sorry,
Okay.
not inflammation of the inflammation of the skin. And so, what we like to do so that we can treat it quickly and effectively is identify what's causing the inflammation, which there are so many different kinds, things that are happening, whether we are breaking out in a form of bumps around the mouth, or we came in contact with something that has caused a allergic contact dermatitis. That's up to the doctor to decide and treat and see how you're responding to medication. So we take that's sort of what we do on a day-to-day basis. Rashes in general are complex and they can look similar, in different places of the body. And so we want to really take the time to understand the story and what's going on so that we can tailor the treatments. Eczema is a condition, we call it eczema. The other term for it, atopic dermatitis, oftentimes occurs in childhood. Sometimes children will outgrow it, but it can occur later on in life as well. That's when the skin barrier isn't, we're prone to getting dry skin. The skin barrier breaks down a little bit more easily, and then we kind of break out in itchy, scaly patches that then just become itchier, scalier, and more red. So we kind of talk through that. And we do tend to see that flare up in the winter time. So, as we move into fall, winter, kind of circling back around, it does get dry, it gets cold. The skin barrier tends to break down a little bit more. And if you're already prone to having some of these rashes, this is the time that they'll get triggered to flare up because of that, the skin barrier is breaking down. So moisturizing is going to be so important. And then, of course, keeping in mind, getting an idea of something you might have come in contact with, whether it's makeup or a perfume that simply irritated the skin, and then that can sometimes just continue on. So we kind of look for that, and we have different ways of treating.
Well, that's great to know. I mean, the skin, isn't that our largest organ?
Yes, largest organ in the body. When it comes to the skin, many times we'll see rashes that may not have a huge implication as far as the skin's concerned, and we can treat it. But furthermore, it can have an internal implication. Sometimes we see certain rashes come out with certain kinds of cancers that may be coming on, or certain things that are going on internally that we are going to be mindful of having the patient get worked up for. So it's the biggest organ of the body. It's the protection of our body from the outside environment. We definitely want to take that seriously.
Well, I'm learning from you in so many different ways is remember to moisturize, which I believe I do every day. And sometimes I felt like I was overdoing it, but now I'm not feeling that way. But also remember the sunscreen, right?
Yes. Sunscreen, broad spectrum. We live here in the Central Valley, so we're getting year-round sun, even in the wintertime through window glass. On a gloomy day, we still get, through the glass, we get penetration of UVA. UVA and UVB are both implicated in skin cancer. The broad spectrum sunscreens that we're using, that will say it on the label, helped to protect your skin against the damage of both of those UV rays. We like to recommend mineral sunscreens or physical blockers that have titanium dioxide and zinc oxide, because they help to reflect and bounce out the UV. And they're safer for younger, children, pediatric patients, a little bit less irritating. The implication is that it's all of this accumulated UV through the course of your life that puts you at risk for skin cancer later. So when I have patients that we've been doing skin checks and they've told me, I was of the ages where I'd put, baby oil and lay out and bake in the sun. But over the last 5 years, I've been really good about my sunscreen and getting my skin checks. Why did I just get this skin cancer? And it's really from all of the damage through time. So we're really trying to tell our younger population to be mindful of this. And, I think that the younger generation has understood it, because I do find them being interested in skincare, wanting to wear sunscreens. And these are good habits to get, into early on. So this is sort of what we've learned from the older generation.
Wonderful. Is there any last thing that you would like to share with our viewers that I neglected to ask you about?
I think the most important is to remember that the skin is the biggest organ in the body. And if you're seeing something that's different that you just don't understand what's going on, you can turn to things online, but Google doesn't always give the best representation of what either the diagnosis is or the treatment options are. And it can sometimes cause a lot more mental stress than what needed to occur. So don't hesitate to see your doctor, see a primary care physician, but most importantly, a dermatologist who specializes in the skin so we can kind of make a thorough evaluation and really just treat it just as any other organ in the body. So.
Okay. And one thing that we did not touch on that also does involve skincare, of course, but that's a segment in unto itself. And that is taking a look at your moles and your beauty marks. And maybe that's something that we can talk about down the road so that if we see a change, we don't just let it go. We make an appointment.
Absolutely. We're always here for that. We would rather you come in, the sooner the better. Of course, that form of skin cancer that is very near and dear to us and making sure we diagnose quickly is called melanoma. So we want to get ahead of the game and we want to make sure that there's quick and easy communication for you, the patients out there.
Okay, Dr. Rohini Shantharan, thank you so much for your time and helping us itch less and be more confident in the skin that we have. Appreciate it.
Thanks so much for having me, Kim. Thank you.
Hi, I'm Monty Torres with Fox 26 News on YouTube. Thank you for checking out our YouTube channel, where we have loads of great content for you to choose from. And while you're here, why not click on the subscribe button right here? That way you can stay in touch with all the latest breaking news, everything news related within the Central Valley. And thank you for watching.